Hi, so tell us who you are and your role and what we're here to talk about today.
I'm Kevin, I'm one of the charge nurses on EF4 Surgical Oncology here at the JERV. I'm here to chat about Bed to Better.
So tell me about the Bed to Better initiative.
Okay, so Bed to Better is an initiative we have on our ward where our therapy assistants and our healthcare aides go together as a team to help get patients up in the morning so that they're up first thing, sitting in a chair to eat breakfast.
I know this may be a very basic question, but why is it important for our patients to get out of bed as soon as possible?
A lot of different factors. One, lying in bed for, the research is a bit variable, but as little as 24 hours can start seeing legitimate strength losses in our population. And as healthcare aid serves a very elderly population, those strength losses are very, very difficult to reclaim. So by starting off on that initial first thing in the morning we're getting up, we're helping to promote retention of that strength. It has the benefit where, again, elderly population at risk for delirium where they get confused. One of the strategies for reducing that is getting them on a very consistent schedule, making sure that they are awake at a good time, going to bed at a good time, up for meals, have whatever sensory aids such as glasses or hearing aids that they need. So by having it start of the day, we are getting them up. We are promoting a reduction in delirium through that. Nutritional, hospital is an area where a lot of folks don't get their adequate nutrition. So we're getting them up for breakfast, starting off the day where they are primed to be eating, set up in a way that they can most easily approach it.
Yeah, it's so exciting to hear that it's wonderful medical treatment, but also some of these basic skills that we're supporting patients with. Tell me what happens when patients decompensate if they're in bed too long. What are some of the other challenges? You talked about delirium, but
you also end up running a higher risk for pressure injuries, more commonly known as a bed sore. The language has kind of evolved over time, taken on a couple different names, but our current one's pressure injuries. So if they're in bed for extended periods of time, they're at risk for a higher risk for that. Other risk factors for it can be the lack of nutrition. So again, we're helping reduce our patients' risks of pressure injuries through early mobilization.
So you mentioned this program touches on a lot of areas. It has the opportunity to improve patient outcomes in a lot of areas. But what would you say is one of the biggest advantages to patients?
So I'd say the thing that I love most about it is that it helps reduce the risk of patients getting deconditioned. If you take that risk of deconditioning down the road a ways, you have folks who are coming from home. To be independent at home when you're elderly, there's a lot of risks. A lot of folks have stairs in their homes to get up to the bathroom, to their bedroom. So you, over time, will see them start losing that freedom where they start sleeping on the main floor or only using a specific bathroom. And then if that keeps progressing, those losses of strength, and they can't regain those or keep them, long-term, you're looking at a risk for long-term care, which, while is a very valuable, important part of our healthcare system, most folks very much want that freedom to be able to live at home for as long as they can.
Let's talk about your team a little bit. Has this changed the way the team works together?
I especially love the aspect, that 7:30 to 8:30 range is one of the busiest times in a nursing shift, at least for my ward and every ward I've ever been on. So getting patients up for breakfast has been a nursing goal for as long as I've been a nurse, but it's also one of the most challenging times to get patients up. So having a dedicated team for some of our patients who need it most to make sure that they're getting up, I don't actually have words for how much that matters to me. It's a very excellent thing.
But tell me more about that. How much does this matter to you? Has there been a wonderful story that's touched you or a challenge you've been able to see someone overcome through the program?
I can remember one distinct patient. He was an older gentleman with fairly advanced dementia. Early on, he was starting to develop a bit in the way of delirium on top of that. So he's one of those patients that is most challenging in that busy time in the morning to get up, while also being one of the patients who is going to see the most benefit from getting up. And every morning, without fail, I got to, as I'm walking down the hallway, see this gentleman up in a chair, sitting with his table, his breakfast, some other supplies from our geriatric team to help keep him occupied. I greet him, and I got to see as his delirium over time kind of started to go away, and I got to see a bit more brightness from the man that was underneath that bit of confusion.
Isn't that wonderful? It's wonderful to see the impact on patients. That's why we're all here. Yeah. So thank you so much. Thank you so much to you as well as to the entire team for moving this forward. It's wonderful work.
Thank you for taking the time to highlight the program. It's a very good program.
We're excited about it. Thank you so much.